Childhood obesity should not be stigmatized, and patients should undergo proactive treatments per new guidelines released. The American Academy of Pediatrics released these measures, and joining us now is board-certified pediatrician and weight loss specialist, Dr. Rinku Mehra. And Dr. Mehra, you and I, good morning. Thanks for joining us.
Hey, you're welcome.
You and I were talking about this. It's made quite a splash. I was reading through the report, and it was pretty stunning, but you're saying a lot has led up to this. Break down briefly what this report was about.
Yeah, so the American Academy of Pediatrics has released new guidelines that really give us a comprehensive understanding about the management of childhood obesity. And we've been talking about it for many, many years, but now they've given us evidence-based guidelines to not only manage and treat with lifestyle intervention, but also guidance on how to use medications and sometimes even surgery for the right types of patients.
And you're saying this has been a long time coming. This problem has gotten increasingly worse in the past few years from what you've seen.
Yes. So now we see 1 in 5 children qualifies for the diagnosis of pediatric obesity. And that's in the U.S., about 14.4 million children that are classified as obese. And the long-term implications are, really are stunning. We're seeing more and more children with type 2 diabetes. We're seeing children with high blood pressure at an earlier age. We're seeing children with high cholesterol at an earlier age. And so we really feel like we need to have our children be the healthiest that they can be.
So a lot of these, first I want to ask you, I want to make sure that folks know what it is that is being recommended in some cases. We're talking about gastric bypass, vertical sleeves. Is this like worst case scenario? How do you know your child would be perhaps one of those people who would qualify for that or be at that point?
Yes, so the first thing is to have an appointment with the pediatrician. And so we really classify overweight as children with a body mass index over the 85th percentile. Okay. And that is matched for age and gender. So overweight is over the 85th percentile. Over the 95th percentile body mass index is considered obese. And so really we're not recommending, and the AAP is not recommending surgery as first line. It's recommended for certain patients who meet certain criteria. And obviously if they have, high blood pressure, severe diabetes, high cholesterol, this is a discussion that needs to be made with their pediatrician or an obesity specialist.
A lot of folks are saying this is giving the impression that folks have just kind of thrown their hands up and have given up, and now we're resorting to, drugs or these drastic surgeries. What's your reaction to that?
Well, lifestyle intervention is always the first step that we take. We are not saying to recommend, medication or surgery right away, but obesity is a complex disease, and we in the medical community are learning more and more about it every day and every year. And so it's an interplay of genetics, the environment, certain medications patients are on. We always talk about lifestyle first and doing what we can to change, eating habits and exercise. But sometimes, because obesity is such a chronic disease, we do need to have other tools at our arsenal.
What would you recommend? What would you like to see? Because obviously we know food deserts, often race plays a factor, things like that. What would you like to see on a larger level, perhaps, to be a little more proactive so that we're not in this position in the first place?
Well, like I said, obesity is very complex, and so the AAP guidelines currently do recommend the whole child approach. So focusing on the family, focusing on the environment, focusing on things in the school and the community at large. And so I think we need to have a discussion, in our communities, in our homes, in our cultures. I mean, there's some cultural differences as well as far as what's considered healthy food, what's considered a healthy lifestyle. And so I think we need to take all of those things into account to make a difference.
Yeah. So essentially there are many, many steps that should and do take place before you get to these last points. But it's certainly, it's sounding the alarm.
Yes,
that
it is.
We have a big problem here.
Absolutely, absolutely.
Important discussion to be had, not just here with you, but also for parents and caregivers out there with your pediatrician. All right, there's the information for Dr. Mehra if you'd like to know more information. And I would encourage you, the report is long, but I would encourage you to check it out and ask your doctor if you have any more questions. Board-certified pediatrician and weight loss specialist, Dr. Rinku Mehra, joining us this morning. Steve, I'll send it over to you. All right.